Hey, my name is Luke Schellenberger. I'm an ENT doc. So patients a lot of times come in and they are just driven nuts by their tinnitus or ringing of the ears. And so a lot of times they say, my ear is ringing. Can you just chop off my ear? People thought that this might have been the reason why Vincent van Gogh did that. I guarantee it didn't work. So the problem with tinnitus is not an ear problem. Yes, maybe there's a little bit of an ear problem, but it is mainly a brain problem, because tinnitus is not a sound, or ringing in the ears is not a sound generated in the ear itself. It is generated in the brain. And so the brain is trying to tell our ears something. And usually it's trying to tell our ears that it's not receiving as much signal as it always has. And so if there is a decrease in signal, especially on one side, the brain will feed that signal, trying to alert us, hey, I'm not hearing as well as I thought I should. Now, sometimes patients will have normal hearing, and the thought is, well, maybe you had even better than normal hearing and it dropped a little bit, even by 5 or 10 decibels, you're still in normal range, but the brain is still not receiving all the signal that it thinks it should hear. Most patients who have tinnitus will say, I don't notice it, it's not as consistent. Now, sometimes patients say, oh, it's all the time, but almost everyone will say, it seems to be worse when I'm at night. Patients almost always will say they get into a soundproof room like our audiology booth and say, oh my gosh, my tinnitus went bananas. Why did that happen? And that's because there's no background sound at all for our brain to focus on. Our brain is easily distracted. And so, for example, if we're watching an interesting movie, most patients are not watching that movie going, tinnitus, tinnitus, tinnitus. I mean, always having that sound. But when patients are doing something quietly, trying to go to sleep at night, for example, we typically kind of shut down the sounds. And for a lot of patients, they say, oh yeah, I always have a fan on beside my bed at night, or the tinnitus drives me nuts. But some patients don't. And so masking therapy, and this is a little device that makes sound. So this is it's making a little ocean sound there. You can turn it on enough, and it doesn't have to be overwhelming, but even having any background sound will allow our brain to focus more on that than on the ringing. And the problem with tinnitus is the more we focus on it, it will get louder and more annoying. Well, obviously, we want to try to focus on it less, and if we focus on it less, it will become quieter and less annoying. It's hard to conceptualize that when you're dealing with an annoying problem to begin with. But at least one easy method to begin with is to having background sounds that our brain can at least focus on more than the tinnitus itself. Okay?